Good morning. Thank you so much for the organizers for inviting me today. I'm Hila Milo Rasouly, and I'm going to talk about demystifying genetic testing. This is my agenda for today, and let's jump into it. So these are the potential motivations to undergo genetic testing. And I'd like to highlight or emphasize that any motivation is a good reason. Any reason is a good reason to do genetic testing, and nobody should stand between you and the genetic test. So some of the reasons why clinicians or patients have shared that they are interested in doing genetic tests is to create an informed and appropriate treatment plan, determine eligibility for clinical trials, clarify the etiology, the reason that you developed the disease, and end the diagnostic odyssey, know better about the prognosis, access reproductive options, determine the risk of family members to develop ADTKD, or access a disease community like this one. So you've heard a lot about research for ADTKD, and I'd like to shortly discuss the difference between research and clinical testing. And really, this talk today is focused on the clinical testing. So just to review the differences between the two. So first, the goal of clinical genetic testing is to elucidate the patient's disease etiology, as opposed to genetic research, where the goal is to increase general knowledge. Now, sometimes these two can go together. The genetic test sensitivity and specificity is also very different between clinical test and research test. I would say, in parentheses, the MUC one is kind of the exception to the rule because it is still done in a research setting, but it's really done in a research setting because a clinical test is not yet available. But there is, in general, the sensitivity and specificity to a patient condition is higher with genetic tests done in clinical settings, assuming that the correct test is done. On the research side, if you are not just participating in a research study on, let's say, genetics of kidney diseases in general, then MUC1 will not be included in the analysis, and also the sensitivity and specificity of all the genes associated with ADTKD might not be so high. Regarding the results, there is also a very big difference between clinical and research. The results in clinical testing are placed in the medical records, they are shared with the medical team, and they can inform care. Anonymized data might be shared with researchers and pharmaceutical companies, but it depends on the laboratory consent, and it's not the norm to share the data. Usually, there are companies that, if they use the data for research, is their internal research inside the same laboratory where you did the test. The results on the genetic research side, on the other side, are not always returned to participants. They are usually not shared with the medical team. They're usually not put in the medical record, and they're not available to your clinicians, to your doctors for care and management. Anonymous data can usually be shared with research collaborators. In the United States, if you are funded by the NIH, it's actually a requirement to share the data with the researchers community, and it's also sometimes shared with pharmaceutical. It depends a lot on the consent. There are now more and more academic centers sharing data, working together, collaborating with pharmaceutical companies. So, now, focusing on clinical testing, what should you expect from a genetic counseling session, with this idea of maybe it is worth going and talk with a genetic counselor or with a nephrologist specialized in genetics? So in a genetic counseling session, your medical history is going to be collected, so the doctor or the genetic counselor can formulate a more specific kidney disease diagnosis, evaluate for any extrarenal features, and determine the kidney disease age of onset and the rate of progression. on the family history. Then the family history is collected, usually a 3 generations pedigree, so 3 generations family history. The goal is to assess different inheritance patterns. So it is very important to come with as much information as you can about your family. And it's also important to share when you don't know, as opposed to saying that the person is healthy. Being healthy and you not knowing about the health of a person are very different. And then the doctor or the genetic counselor are going to assess for the etiology of the disease and consider the probability of a diagnosis and which test could be relevant for you. And then there is an informed consent process where the different options are discussed and also the cost are discussed, and then you choose whether you want to undergo genetic testing or not. So going to a genetic counselor doesn't mean that you have to do the test. You can also decide at the end that you don't want to do the test. So I'd like now to focus on genetic tests for asymptomatic individuals. There are 2 main reasons why someone who doesn't present with any kidney symptom would want to do genetic testing. One is healthy family members who just want to know if they are at risk. So in this example of a family tree, as we like to draw them in genetic counseling, with the arrow on the bottom, you can see a man who has a disease. Let's say, in this case, it would be an X-linked disease, and he has a genetic diagnosis now. And then the question is, what are the risks of his sibling brother and his cousins to have the same disease? And so in this case, genetic testing can be offered to answer this question. Another reason to undergo genetic testing when you do not have any symptom is to know whether you are a good, eligible donor. For if you want to donate your kidney to a loved one, part of the transplant evaluation is to know whether you have any kidney disease or not, and genetic testing can be very useful if your loved one has already a genetic diagnosis. You might see here that I did not include minors, so children of people with disease, with ADTKD, for example. So this is because genetic testing of minors is not recommended. The child's best interest is the gold standard in medicine. We want to reach to child's physical and psychosocial well-being. In genetics specifically, we believe that the child has a right for genomic privacy and the right to an open future. They have a right not to know. Genetic testing is actually recommended for minors only if it impacts the child's medical care, which is something that may change in the future. So if a drug in the future will be recommended from before the age of 18, then genetic testing would be recommended. Just wanting to know from the parent's perspective is not enough, is not recognized as a reason to test a minor. And genetic counselors can help with the discussion, especially when the two parents do not agree about that, and you may want to have a mediator, someone who will help you with the discussion. Genetic counselors are a great resource. Broadly, genetic counselors are a good resource for familial communication. It can be hard to share a genetic diagnosis with family members and telling them that they are at risk to develop a genetic kidney disease. So genetic counselors can provide resources and guidance on how to share results with at-risk family members. They can write letters to your family members. They can also write letters that are anonymous without telling that you are the person with the genetic disease, but just saying there is someone in your family and they shared your information, and here is the type of genetic variant that was found, and it is recommended for you to get tested. And genetic counselors can facilitate genetic testing of family members. In the United States, there is a law that protects against genetic discrimination. It protects against genetic-based discrimination in two contexts. One is employment and the other one is health insurance. So the law prohibits employers from requiring, requesting, or conditional approval or employment on the submission of genetic information or family medical history. So that's for both. So that's important for you who, if you did not get genetic testing done, you're also not required. I mean, you are protected by law, and you can tell your employer that you do not want to share family medical history. GINA, which is the name of this law, also protects against health insurance discrimination. So health insurance is not allowed to ask about your genetic information to determine eligibility, the benefits, or the premiums. However, GINA has some limitations. It's only covering for employers with 15 or more employees. It does not include life, long-term care, and disability insurance. And it applies only for pre-symptomatic individuals, with the idea that if you already have a kidney manifestation, then you would be covered by the ADA, the American Disability Act. However, what counts as manifested is not determined, and that can be like a gray area, because you might not have a disability, but also maybe seen as manifesting the disease already. So I promised to share how to find a genetic counselor. So on the left here in the United States, there is a website developed by the National Society of Genetic Counselors. You can choose if you want to see the genetic counselor in person or by telehealth. And you can also choose specifically genetic counselors who are specialized in nephrology. So you can see genetic counselors who knows what ADTKD is. In all the other countries on the right, mostly Europe, but not only, there is Orphanet, which is another great resource to find expert centers. So again, a way to meet with providers who know what ADTKD is. So I'd like to thank you for listening, and thanks all my colleagues. And feel free to reach out with any question. My email is listed here. Thank you very much.